Hi, this is Dr. Vic Khanna talking today a little bit about a common condition we see in our dermatology office. And this is a condition called vitiligo. Vitiligo is an autoimmune skin condition where it manifests with white spots that will form often in obvious portions of the body, around the eyes, around the lips, the nose, the ears, the fingertips, the toes, sometimes in the private area as well. It can also manifest on any body area or even in hair-covered areas like the scalp where it might produce white hairs or eyelashes or eyebrows. This condition, you can imagine, can be devastating because of its obvious nature. And it's generally not associated with a lot of other health problems, but we will often check some blood tests and examine the skin looking for a few other conditions that can be related to it. As a first line of treatment, we'll often use a combination of topical immunomodulating creams along with topical cortisone-based creams. And we often have a very high success rate, especially if we catch the lesions early. It's especially useful, in my opinion, in small children. We have excellent results with kids usually. It's also very effective on the face in particular. In addition to that, we may use lasers. In our practice, we do have the excimer laser, which is very effective for it. Sometimes with rapidly progressive vitiligo, we may encourage the patient to do a short course of oral steroids to help break the autoimmune cycle. Sometimes we'll also use compounded medicines and new classes of medicines that are under investigation, but in anecdotal reports show a lot of promise. And these ones that are safely compounded into dilute cream formulations may work well. And this is giving even our resistant patients some hope. This is a condition that can run in families, but can also be, an individual might be the first one affected, and it can present at any age. We have patients, like I just saw a patient that presented in his late 50s with vitiligo, and he's quite devastated with it. But we see it in babies, and we had a child in earlier today who had it, who was probably about 8 years old. So it can come at any age. And in kids, of course, there's a lot of stigma associated with it because of its obvious nature, and sometimes they get teased as a result of it. Obviously, anybody at any age, if they have facial involvement, is going to be bothered by it. But the good news is, here at Dermatology Specialists of Illinois, we have a lot of choices in terms of treatment, and a lot of safe treatments, and many of which become effective. So we're really excited about the prognosis for our patients with vitiligo. Thanks.